And really, hopefully, out of that, we then want to create a community like this that can push people forward. I think that these pillars are so exceptionally important. And I'll tell you, like you said at the beginning of the Q&A, you said it's not common for people to talk about these other aspects when we talk about food. So I came out the gates, I'll be honest, once I realized that nutrition was the way to go, I was only hitting people with nutrition. And I was not even walking them through. I actually looked down on people, I shouldn't, that sounds bad, but it's true, who gave allowances for people who were not 100%. I'm like, here's your prescription. This is what you need to do. Let's go. We're going to go hard, right? And what I realized is the fact that there's culture that's involved, there's relationship that's involved, there's more that surrounds that people spend 80+% of their lives outside the walls of doctors' offices and hospitals, and that there's a community that's so important that it's either going to support them or it's going to impede them. And so as I started looking at this and listening to my patients over the things that they were concerned about and that were impacting them and that were challenges in their health journey, these things just naturally started to come out of me, based on my upbringing, based on the research, based on things I heard, books that I read an eclectic or I listen to an eclectic amount of books. And I felt as if many nutrition books are powerful, but they leave you with like, okay, that's the ivory tower and I'm down here and I have no hope for me. And how do I go about doing it? Because you should just do it. And everyone's on the high coming away. I'm ready to do it. Well, okay, how do we implement this? What are the other components that are going to increase the likelihood that I'm going to be successful? And that was really the birthplace of like selfish in terms of it, of understanding that these are components. The last thing I'll say with this is another aha moment for me, right? Another aha moment for me. The aha moment for me was the fact that I would always say for some patients, because my billing system is different where I work, I don't get paid based off of the amount of times you come back. It's whether or not I can keep you healthy and start you down the road. And so for some patients, they were coming back and seeing me, and I was like, man, I don't need to see them. This is just more of a conversational. I enjoy the conversation, but and all of a sudden I said, Columbus, you are their community. You're their community. They're coming back like a game of tag. I'm touching home. I'm safe. Now I'm gonna go back out in the world where I don't have that support. You're their community. And so I recognized that was one of the first aha moments about the power of intimacy of relationships and community that's there. And so that's really was the birthplace of selfish and wanting to put out something that was an aggregate and different, but yet different than what's out there as it relates to the core component is still nutrition, nutrition, nutrition. It's like location, location, location. Nutrition, nutrition, nutrition is a foundational centerpiece for achieving ideal health, but it is a fallacy to think that it's not supported. That house is not built. The walls, the insulation, the painting, the elevation by the other components of SEL-ish on top of the F.
So you talk about community and support systems, and so it's very challenging now. I think most of us who are I guess not still kids, grew up at a time where at the very maybe we didn't have the most integrated and robust communities, but kids were outside playing with each other before the advent of cell phones, and therefore the neighborhood kids knew each other, therefore the families knew each other. At least the families of the kids, and there was some sense of community. With the breakdown of community, how has that contributed to stress and physical health issues as well?
Yeah, I believe it's a 1-to-1 ratio. Whether or not we look at the Rossetto effect of how, Italian community, I reference this in the book, basically they seem to be sheltered from the adverse effects of cardiovascular disease. And this is despite their eating habits, right? So that they seem to be somewhat sheltered because of the power of community and relationships that were there, of generational relationships. But as they start, the standard American way of living began to integrate, you start to see that dissipate too as well. So we know I believe there's a direct 1-to-1 relationship, a correlation between the breakdown of the community and the occurrence in the of disease. We see it as well that many of our staunch areas, whether or not this was in school systems where people walk, now they commute, rode your bikes, now you don't. You're driven in cars. We see too as well that there took effort in terms of you had places of faith that were there that were central, and they were community places where people would walk to or drive very short distances. Now people, if they still attend, will commute in. And so it's a different dynamic that now we create these barriers through technology for us to form communities. And there's power that's there when used appropriately, right? And because it's the best that we have. So I think one of the things that I try and encourage is how can we go about creating communities in our own environment? How can we bridge the gap and try to improve? And this is not from a person who knows everything, because I'm challenged to do this even with my own family. At times, son's inside texting here, and well, don't text me from your room. I'm right down the hall. Come talk to me or whatever else, and everything. Let's communicate and creating opportunities for us to communicate. Can we be intentional in our efforts to create opportunities to engage with others? And I think that becomes a key importance. And whether or not it's play dates, whether or not it's team sports, whether or not it's activities, whether or not it's finding like-minded approaches, because we have to do something to combat this idea of loneliness. This idea of loneliness has been shown, increasing data tells us a direct correlation of chronic disease. There's direct correlation between community and the improvement of health outcomes, the adherence to healthy eating, the lowering of diabetes. I referenced a number of different studies and different groups who brought up, and they were able to go ahead and really impact this on a positive note.
So I'm not familiar. I'm not sure if you're familiar with this. There was a TED talk that was talking about a study. I don't know the exact study, but it's pretty easy to find online. And the TED talk was talking about rats in a cage. And if you left a rat in a cage by itself, and there was water laced with opioids and regular water, the rat by itself would go and drink the opioid water. And then if you put rats in a cage with the same two choices of water, but there were other rats in there and there were activities in there, then all the rats would just drink regular water, right? So it seemed very environmental uh,
Absolutely.
to um, to that extent. How do we begin to break out of this? Based on what you're seeing when people take on all these neurotic behaviors because of this lonely epidemic, and it breaks them down. It brings them down into a path that is so dangerous to their health. And again, it goes back into that cycle.
Yeah, I mean, this is what I was referencing about creating opportunities for community. So, on the health perspective, one of the things that we've tried to do is we've tried to create support groups. And so you think support groups, well, that's because you have like-minded individuals who are going through or you should say, similar experiences, who are going through individuals going through similar experiences, and how that relationship, communication, and dialogue is powerful. That's one of the benefits when we talk about stress. We oftentimes think that, well, I just want to zone out and watch TV and go by myself, have a beer, do whatever, drink, smoke, whatever it may be. But studies have shown that you actually lower your stress hormone by when you engage in conversation with someone else. That is, if you take that moment for a trusted individual, that you can lower that wall that you built up in terms of like fear and the allostatic load of things, that now all of a sudden you're able to communicate with someone. It lowers your stress. How do we do it? It's a challenge because now we've gotten in ruts. We've gotten into a habit, a vicious cycle of this cue routine reward, that we are staying viciously engaged in this paradigm of staying in isolation. And so it's going to take effort, which means it's going to be painful initially. Whenever you change directions, it creates a small amount of stress that you're going to have to put yourself out there, whether or not it's engaging in a group, whether or not it's choosing to make yourself involved. Another example, I was presenting nutrition at the American College of Cardiology National Conference, 75th anniversary this last week. And so I'm there by myself. I didn't have colleagues who were there with me, throngs of individuals, 75, thousands of individuals that were there. One day I was just like, man, I just don't know if I feel like it going out there with everyone. I'm just going to stay here in the hotel until time for my talk. And so I woke up next morning. I was like, nah, you should go. And I went out there and I forced myself. I said, okay, you're going to choose engage. You have to engage everyone, but try and, network with at least one person each session that you go to. And I'll tell you, that was very rewarding as I went through. I told you I'm an introvert. So I physically had to put myself out there, and I had very beneficial time by saying, listen, I'm going to network and making myself communicate, handshake, look in the eye, having a conversation about things, trying to infuse nutrition into these interventional cardiologists, whatever it may be. And I'll tell you that was powerful, but that took effort. It took a level of stress. It took a level of planning and saying, I'm going to do this today. And so whether we do it with our kids in terms of play dates or going out something functional with other individuals or groups, I think we have to be intentional and set a plan. And that is one of the things I talk about is how do we go about achieving this? What's our approach towards having more intimate relationships, social connections, and so forth? But it's going to vary for everyone, and it won't be just plain simple, easy. It will take effort.
So now, when people think of a cardiologist and going to the cardiologist, they think of going in, getting some tests, and then being given drugs for any symptoms they may have. How do your patients, that's the first question, and then second question, how do your colleagues respond to your message of how to regain their health that doesn't seem to be pharmaceutically based or pharmaceutically centered, I should say?
Yeah, that's a good question. And I mean, at this point now, after years of doing it, I mean, I've really been doing this almost coming up on 15 years soon, in terms of being engaged in aggressively lifestyle. My colleagues are used to me. But when it first started off, it was just like, oh, okay, what's he talking about? Okay, whatever. And I'll be honest, like the first time I went down this road, I didn't have any elevator pitch. I started, it was just starting. All I did was recommend a few books. And so I had saw three patients back to back to back, who have bad disease. And my colleagues just said, hey, Columbus, would you see them? And you may need to do intervention on them and so forth. And I gave them the books. I didn't have any pitch. I was like, you know what, you should consider doing this. Each patient came back with markedly improved symptoms.